Phenystiel gel has an anti-allergic and antipyretic effect, reduces increased capillary permeability associated with allergic reactions. When applied to the skin, it reduces itching and irritation caused by allergic skin reactions. The drug also has a pronounced local anesthetic effect. When applied externally due to the gel base, the action with a slight cooling effect begins after a few minutes and reaches a maximum after 1 to 4 hours. Active substance dimetindene. Indications: skin itching or various origins, except associated with cholestasis, with itchy dermatosis, eczema, urticaria, insect bites, sunburns, domestic and industrial burns, mild. How to use: apply externally. The drug shall be applied to the affected areas of the skin 2 to 4 times per day. In cases of severe itching or widespread skin lesions, the simultaneous use of oral forms is recommended. Contraindications: angle closure glaucoma, prostatic hyperplasia, children aged up to 1 month, especially premature, hypersensitivity to dimetindene and other components that make up the drug. With caution, phenystiel should be prescribed with the first trimester of pregnancy and during lactation, breastfeeding. Special instructions: in case of severe itching or damage to large areas of the skin, the drug can be used only after consulting a doctor. When using the drug phenystiel on large areas of the skin, exposure to sunlight should be avoided. If during the period of use of the drug phenystiel, the severity of the symptoms of the disease does not decrease or increases, a doctor's consultation is necessary. The drug is ineffective for itching associated with cholestasis. Side effects: from the skin and subcutaneous tissues, infrequently dry skin, burning sensation of the skin. Allergic reactions: very rarely, allergic dermatitis including skin rash, itching. If any of the above side effects worsen or any other side effects occur, the patient should inform the doctor.